Thank you so much, Nicole. Can you guys see my slides okay?
Yes,
Do you see the notes page or just the regular PowerPoint?
just the PowerPoint.
Okay, perfect. So hi everyone. Thank you so much for having me here today. I'm excited to talk about this particular subject because it's near and dear to the work I do over at the Cleveland Clinic. So as Nicole mentioned, I'm a health psychologist here at the Cleveland Clinic. I have a joint appointment between the Mellon Center for multiple sclerosis, and then I also work in the behavioral sleep medicine clinic. The majority of my work is spent with patients and their families coping with neurological disorders. I generally work with families adjusting to various neurological disorders. I actually run a caregiver support group over here at the Mellon Center. So this presentation was put together with some of those common strategies, tips, and skills that we often talk about in the caregiver support group. And as Nicole said, if you have questions, please let me know. I am happy to answer questions. So this is a useful kind of presentation for you. So a couple of the learning objectives, we want to understand the challenges of caregiving. If most of you on this presentation or on this call are caregivers, you'll know these well. The majority of the presentation is going to be spent on identifying coping skills to help promote your own psychological and physical well-being, and then understanding steps to reduce caregiver stress or burden. Now, I will use those terms interchangeably. Often in the literature, it's referred to as caregiver stress or caregiver burden. But when I talk about them, they're often used interchangeably. So I'd like to get something out of the way first, and that is that first you have to help yourself. Now, most of the times when I'm talking to caregivers, this is one of the most challenging pieces of caregiving, is actually ensuring that you're taking care of yourself. So I just want to get this out of the way first, is that oftentimes what caregivers struggle with is first helping yourself. So, you know, the age-old kind of adage on a plane, an oxygen mask descends in front of you. What do you do? As we all know, the first rule is to put your oxygen mask on first before you assist anyone else. Only when we first help ourselves can we effectively help others. And that's a really important piece here. Oftentimes caregivers have challenges with this. And so we're going to directly talk about that today and ways that you can take care of yourself when caring for others. And another important piece is that when you take care of the needs of yourself, the person that you care for will benefit too. Breaking old patterns is, especially with caregiving, is very challenging, and it's not an easy proposition, but it can be done. And so I also want to be clear that there's going to be some examples that I have for self-care during this presentation. And they're just examples of things that you can do or implement in your own life, but by no means are they exhaustive. There's going to be some resources that you can help get some other kind of examples or ideas of how you might care for yourself at the end of the presentation. Okay, so now that we've gotten that out of the way, let's discuss a little bit about who I'm talking about. So who is a caregiver? There's both formal and informal caregivers. So formal caregivers are paid health aides or volunteers, and informal caregivers are what this definition is. And so that's what we're going to focus our discussion on today, is informal or family caregivers. So the literature defines a caregiver as any relative, partner, friend, or neighbor who has a significant personal relationship with, and also provides a broad range of assistance for a person in need. Now, most times we think about physical assistance, but this also includes psychological assistance for somebody that receives care. So, you know, caregiving can be deeply satisfying, as partners and family members can be drawn closer together during a caregiving relationship. In fact, for most caregivers, being there when a loved one is in need is a core value. You discuss these things when you start to get married or that you're taking care of your children. And so it's an expectation. But often the shift in roles and responsibilities and emotions is almost certain, especially in the caregiver relationship. So it's natural to feel both deeply satisfied that you're able to care for a loved one, while also feeling angry, frustrated, exhausted, alone, or sad. And so I want to stress this, that caregiver stress or burden is normal. It's common. And I want to repeat that. So caregiver burden is common, especially given the complexities of it being a very rewarding and a core value, while also experiencing anger, exhaustion, and loneliness. So as the demands physically, emotionally, and cognitively increase for the care recipient, often less time is available to be devoted to the caregiver's own needs. And that could be home care, that could be a career, that could be spending time with loved ones. So oftentimes caregivers will feel a significant demand or burden on their own coping mechanisms or their endurance. So this can lead to caregiver burnout or caregiver stress. So most caregivers that I talk to in my office or when we're having our caregiver support room talk about or oftentimes relate to this idea of being a professional juggler, right? So there's a strain of balancing either employment, child rearing, increased responsibilities in the home, and ongoing care of a loved one. So when you're a professional juggler, it's really hard to then take care of your own needs. So while this is common, there are ways to help negate or lessen the strain of caregiving. And so, you know, depending on where you are in your own caregiving experience, whether it's early on or you've been a caregiver for quite some time, or you've cared for various different people over your lifetime, you probably have found that one of the biggest mistakes that caregivers make is thinking that they can and should handle everything alone. The best way to avoid burnout is to actually have practical and emotional support. Now, this can look very different depending on the needs of the person receiving care. But again, thinking that you can and most importantly should handle everything alone can create some issues in your own life in regards to anxiety, depression, and just overall feeling overwhelmed. So what is caregiver burnout? We're going to talk about some risk factors and some signs to know if you are feeling burned out, or if you're concerned about somebody in your family that's a caregiver that may be experiencing burnout. And so this is kind of the textbook explanation of what burnout is. So it's a state of physical, emotional, and mental exhaustion. It can be accompanied by different changes in attitude. This can be a change from positive and caring to more negative, ambivalent, unconcerned kind of attitude towards caregiving. And it can be both a subtle shift to more drastic at times, depending on how often you're giving care, how many hours, who the person that you're giving care to. So the risk factors for caregiving are here listed. So based on the literature and research, there are well-established risk factors for caregiver stress. And just to be clear, a risk factor is essentially something that increases the chance that caregiver burnout will happen. So the more risk factors that a caregiver has, the higher likelihood he or she will develop caregiver burden. And this is especially if there are not preventative steps taken to address burnout. So some of the risk factors that are well known are being female. Most often caregivers tend to be female. Living with the care receiver, social isolation, financial difficulties, higher number of hours spent caregiving, lack of coping skills or difficulty solving problems due to being overwhelmed, and a lack of being a choice in the caregiver role. So here's some signs of caregiver burnout. By no means is this exhaustive. But look, too much stress, especially over a long term, can harm your health. As a caregiver, you're more likely to experience symptoms of anxiety and depression. In addition, a lot of times caregivers don't get enough sleep, physical activity, tend to have difficulties eating a balanced diet, which all can increase your own risk of medical problems. So if you have 2 or 3 or more symptoms on this list, you are likely to be experiencing burnout. And you should pay close attention to some of the information we discussed today to reduce that level of burnout. So feeling overwhelmed or constantly worried, more times than just once during a week, feeling tired often, getting too much or not enough sleep. That can go one way or the other. So either getting too much sleep can be a sign of depression. Not enough sleep because you're up worried about the person you're caring for. Gaining or losing weight can be a sign. Becoming easily irritated. Most of the times when I have people come into my office in regards to caregiver burnout, this is the big one. So having less tolerance, finding, it goes 0 to 10 over something insignificant and getting angry. So these are some signs. It's by no means exhaustive, but these are often what I find present in my office when I'm helping families with caregiver burnout. So we're going to talk about the majority of the rest of the presentation is going to be strategies to help cope with burnout. And so I want to highlight the fact that when you're a caregiver, it's very easy to feel invisible. Everyone's attention usually goes to the person you're caring for. And at times it can seem like no one seems to understand what you're going through or what the caregiver is going through. Oftentimes I'll hear caregivers say, I'm invincible. It doesn't seem like anybody cares to ask how I'm doing. And then the big one is, well, I don't want to complain, that I'm struggling, but I don't want to complain because insert X, Y, or Z. So we're going to discuss some of the specific strategies to help cope with that burden and stress. The big thing I want you to just remember is that the changes need to be and start slow and make small changes so that they stick. So if you take one thing away from this presentation that you can change, you're ahead of the game. So in general, it's human nature to focus on things that are outside of our concern or outside of our control, I'm sorry. And so uncertainty is hard for the brain to figure out, especially during these times. There's a lot of uncertainty just in our world, but then you throw caregiving in there and there's a lot of uncertainty of, care for the person receiving care. But it turns out our brains love and crave consistency. So caregiving can be overwhelming because there seems to be a lot of things outside of our control, plus inconsistency. So as we go through some of the topics I'm going to discuss, try to focus on the things that are controllable in your life. They may be different for somebody, for your sister, for your mom, for your brother, for your friend, for your dog. The things that are controllable in your life, they may look different than other people in your family. So some of those things could be diet, exercise, spending time with loved ones. But again, try to focus on the things that are controllable in your life. So the first thing I always like to start with is SMART goals. So as you start to think about the areas that you may have control over or want to change, think about this acronym. So SMART goals. We want to set SMART goals to ensure that the change is lasting in your own life. So the big one is when you set goals, you need to be specific. So when I have, again, people in my office, I will say, okay, let's set some goals of what we want to do to change so that in 6 months, we know that we're moving towards something. And so I might hear something like, well, I want to be a good caregiver. So it turns out that this isn't very specific, the goal of wanting to be a good caregiver. It's hard to measure. We don't know if it's attainable. Yes, it's realistic and it's timely because you want to take care of the person you're with, but it's hard to assess, am I being a good caregiver or am I not? So we want to try to take the ambivalence out of this. And so a more specific goal might be I want to be sure that the care receiver, albeit my husband, child, friend, aunt, is getting to each appointment on time. Okay. So that's one way that you can make sure that you're being a good caregiver. But more importantly, for this particular discussion, goals around your own well-being are going to be important. So another goal sometimes that I get is, okay, well, I want to prioritize my self-care, period. So again, that particular goal is hard to gauge. So a better goal would be, I want to prioritize self-care. So I'll take 5 minutes per day to myself and do breathing exercises. So that's specific. It's measurable because I know whether I'm doing it every day for 5 minutes. It's attainable that I could get 5 minutes in my day to spend for myself. It's realistic and it's also timely. So start to set goals for your own health, as well as the person that you're caring for. But specifically to this discussion, setting your own goals for your own health are going to be important. And again, I'm going to, keep going back to this. Make sure it's something that is important in your own life, not what other people find to be important for you. So the next strategy is to accept help. Now, I'm sure if I could see your faces, you may be rolling your eyes at this because this is a real challenge. Again, it goes back to the expectation that you should be able to do everything on your own. Learning to ask for help is a skill. In our society, we tend to not learn how to do these kinds of things. And so this is by far one of the most challenging things to do, but ultimately provides the caregiver with the most benefit. So, depending on what role you're in, you've often heard the question, is there something you need? Generally, the answer usually is, no, I'm okay. No, don't worry about it. No, I don't need anything. When in reality, there's plenty of things that you need. And so this question should have one answer, and it should be yes. And that yes can be a lot of different things. Yes, I need a meal. I need someone to stay here so I can go out. I need some time by myself. I just need flowers. I need help in the garden. I need some groceries. So even for people in your life that can't provide hands-on care, may be able to take on other tasks that can help reduce your burden, reduce your responsibility. That could be, again, grocery shopping, paying bills, coordinating medical appointments, or handling insurance paperwork, which we know insurance paperwork is really challenging. And the other piece of this that I want to mention is that depending on the level of care that the care receiver needs, you could consider taking advantage of respite care services. So that provides temporary break for caregivers, and it can range from a few hours of in-home care to a short stay at an assisted living facility if needed. So again, is there anything that you need? The knee-jerk reaction is to say no. But maybe you write down a list of things that the next time somebody asks you that question, that you have really simple things that don't necessarily take away from your own joy of caregiving, but helps reduce the burden. Yes, you can cut my lawn. Yes, please shovel my driveway. Those kinds of things that don't necessarily have to be hands-on care, but can take away from the burden. So support comes in many different forms. We know that getting connected is important. Many caregivers often end up withdrawing from friends and family. Most of the time that happens when caregivers feel misunderstood or unheard. And so this leads to feelings of isolation, and that can further perpetuate feelings such as resentment and anger towards the caregiver role or even towards the care receiver. And so, like I said, it comes in different ways. So thinking about ways you can get support. So talking to family, prayer, going to see a professional such as social work or a psychologist or a licensed therapist. I'm going to hit this one hard. Saying yes to help is a big one. Taking walks and even just eating a hot fudge sundae can be helpful. And so understanding that connection and understanding is critical to ensure the wellness of yourself for other caregivers. And I want to highlight the importance of social work and the usefulness of joining support groups. So social work, you can that can help identify local services, whether you just need someone to help with household chores, or a registered nurse to administer medication, or other types of therapists that can come into the home and help reduce the burden that comes along with caregiving. Joining a support group can be really, really helpful. One, for just validation that other people are going through something very similar to you, and that some of the emotions that are hard to swallow, such as anger, isolation, are normative, and finding different ways, creative ways to combat those. I know in our support group, we have a wide variety of different people that are in the group, different diagnoses, different, caregiving roles. And the one thing that is really usually comes up during group is just how we all have different kinds of things that we're dealing with, but at the end of the day, the caregiver experience is very similar. And to talk to other people that are in a similar situation can be really helpful. So, this slide really is important for this one reason. So you need to lean into support as opposed to leaning away from it. And think of it as an adaptive way to cope with caregiver burden as opposed to succumbing to caregiver burden. So setting limits can go both ways. If you've been a caregiver for a while, you've probably heard about setting limits or setting boundaries. I think both setting up boundaries but also asking for help when needed is important. So that's why I include them on the same slide. Setting boundaries with not only the person that you're providing care to, but also family members, explaining to them the expectation that you may have of them, or the time that you have to devote to things outside of caregiving can be important. And then again, I'm not sure if I put it on every slide, but I sure hope I did. Asking for help is huge. Now, if you don't have a group of family or friends to call, this is also very normative, and it can make you feel really isolated. So this website, the National Alliance for Caregiving, can actually help you locate caregiving services and to help choose among some long-term local services to help with the caregiver burden. So even if you don't have a good group of family or friends, you're not alone. There's organizations out there that can help you get a break from caregiving and reduce isolation so that you are at your best self to care for your loved one. And the last part of this is to learn to say no to requests that are draining rather than nurturing. One example that I usually give is that, so you've hosted a holiday in December for 15 years. Something happened to your spouse or to your child, but you're still gung-ho about having that holiday meal at your house. Well, that's going to be really draining. And I think at the end of the day, most people are like, I should have just had somebody else host it. So you can make choices about your life and what's right for you, and have some control over the overwhelming feelings of burden. So the next piece is exhaustion is one of the main complaints of caregivers. And I bet if I was able to survey the crowd right now and I said, are you exhausted either physically or emotionally, that most of you would be raising your hand. So exhaustion can lead to increase in irritability and then anger, which then is a vicious cycle that leads to usually guilt. So either feeling that your anger was inappropriate, so then feeling guilty about that. So understanding the limits of your own endurance and strength is the key to combat this. One way to monitor your limits is by listening to your body. So listening to your body can look a bunch of different ways. The big one is to make sure that you're getting regular checkups about those little tiny concerns. Oh, my knee hurts just a little bit. Well, it's not a big deal. Oh, my back is starting to hurt. So listen to your body when there is some aches and creaks and something that is making it a challenge for you to provide care or causing pain, making sure that you're going to get those checked out. And so taking care of your health, it needs to be a top priority. And so when I discuss well-being and taking time for oneself, I almost always get this reaction, quote, "There's no way I can find time to X." And so you may have said it yourself. And so caregiving can make you feel like there's no time for anything else. There's no time to exercise. There's no time to go for a walk. I have no time to have lunch with a friend, or to even take 5 minutes to myself. So it turns out the mind tends to believe what you tell it. And so this is an essential kind of concept. So if the dialogue in your head continues to be, there's no way I can find time to do X, it's very likely that you will not find time to do X. So we can train the brain to think differently. So starting slow and small, you can work up to some of the bigger things that you want to do in life to get that quality of life back. So you can start telling yourself you will find time. Write down mantras or post-it notes about some of the priorities that you have in your life. Things like, I want to make time for my partner. I want to make time for friends. I'm going to make sure that I walk 5 minutes one time this week. And so replacing there is no way I will find time to I will find time. And we'll talk about some strategies of how you can get this to stick in a little bit. But remembering that your mind tends to believe what you tell it. And so if we can change that dialogue in your mind, then usually the behavior comes along with it. So taking a break. Without breaks, it's easy to start questioning yourself. You feel inadequate, experience burnout, again, the frustration, guilt, isolation. So trying to know your limits, but also to take times to figure out your limits and be honest with yourself about your personal situation. So I always say that taking breaks, like if you feel overwhelmed and stressed, it's too late. So trying to take preventative breaks, ensuring that it's in your day where maybe you're scheduling time for yourself, but it's important to take breaks, or even starting your day with a few minutes to yourself. Enjoy that warm cup of coffee, how it feels in your hands and as you sip the warm coffee, or go for a quick walk and make sure that you're staying in the present moment, smelling the trees, looking at the colors changing. And again, I find it works best if you set a time in your calendar. So use your phone, put in, I'm going to go for a walk for 5 minutes, write it down, invite a friend so you hold yourself accountable. But taking the time and planning it out, because our lives are so busy this day and age that if we don't plan it out, it's very unlikely that we're going to do it. The day is going to get ahead of us, and the next thing you know, it's time to sit down and watch the news or go to bed. So planning the time at 10:05, doesn't matter what I'm doing, I'm going to put it down and I'm going to go for a walk, or I'm going to read a book, or I'm going to call so-and-so, my best friend. So this is a big one that I find it generally can be really powerful for people, which is simplifying communication. I have 2 examples here, but there's plenty of ways that you can simplify communication. So one of the big ones that can be very overwhelming is if you are the point person to update your loved ones about the situation that's going on. That could be phone calls, emails. So there's a couple of things that you can do with this. One, you can designate someone else to be the point person. Maybe it's a adult child. Maybe it's your spouse. Maybe it's a sister. Maybe it's a best friend that is willing to, people outside the extended family, to keep them informed on what's going on with the person that's receiving care. There's also websites that allow you to post updates for everyone simultaneously. And there's controls within it to protect your loved one's privacy. And so I think there's a few different kinds of websites. If you have questions about that, you can shoot it out and I can send you specific names, but that's a really good way for people to stay up to date on the information without overburdening you with those communications. The next one, and I can't stress this enough how important this is, depending on who you're caregiving for, is a lot of times difficult conversations happen at the peak of emotion. So it may be that the day started poorly and there was a couple of arguments, or that there was frustration that wasn't discussed. One person walked away, the other person walked away. And it builds and builds and builds. And then when both people are kind of at their wits' end, they decide to have that really difficult conversation. And so there's frustration, there's irritation, and then it comes out in a way that was not necessarily intended. We want to limit the emotion of guilt. So one way that you can do this is set aside time to have difficult conversations or even pleasant conversations. During a neutral time when there's not much going on. So a couple I worked with a couple of years ago, we said, okay, on Sundays at 4, before we have supper, before they have supper, they're going to take 10 minutes or 15 minutes and they're going to talk about things during the week that maybe frustrated them or wish they could do in a different way. They would keep it to 15 minutes, so it's time limited. And so anything that was not discussed during that 15 minutes, you could talk during the next week, or maybe you have 2 times during the week where you allow yourself to have these conversations. But it's really important to have difficult conversations at a neutral time when you've both had time to prepare, but also, that there's not this peak of emotion where oftentimes things are said that are not necessarily intended. So managing stress is really important. And so we're going to talk about a couple of different steps that you can do to actually manage the stress. So, first is you have to be able to recognize the symptoms of stress or the warning signs of stress. So irritability can look different for different people. Sometimes it's having low frustration tolerance. Sometimes it's crying more than usual. Oftentimes I'll hear people say, it was something on TV. I was watching Lifetime, and the next thing I know, I'm crying. And then that feels really uncomfortable for them. So that's maybe a cue that there's something else going on. The other piece is lashing out at loved ones. Sleep problems, trouble falling or staying asleep, waking up too early. But also on the other side, sleeping too much could be a sign of stress. And then the forgetfulness. So the example I use with this one is when we're using computers, and let's say you have your internet browser open. So let's say you had 2, tabs open, then the computer works pretty well. But if you've got 14 tabs open, your computer usually runs pretty slow. So you can think about your brain in a similar way. So when you have more tabs open, you're worrying about multiple things, trying to keep track of multiple things, and also attending to what you need to do right now. Forgetfulness is going to happen because your system is running a little bit slow. And so what we want to do is we want to close some of those browsers so that your brain can work more efficiently and you can remember the things that you need to remember. So waiting until you're overwhelmed or the system overheats creates more of these symptoms. So first you want to try to, figure out if you have any of the warning signs. And then sometimes this can be a silly question, but oftentimes people don't go through this process of identifying the sources of stress. So what is causing me stress? Of course, caregiving could be a potential source of stress, but is there other things going on? Was it a phone call that you had with your mom, or you got to take care of the dog, or other kinds of stress? Too much to do, family disagreements, feeling inadequate, difficulty saying no. So oftentimes I will tell people to write it down, take some time, 10 minutes, to write down the things that are stressful, and then working through the things that you can and cannot control. So it's important to be specific. So we're going back to kind of the SMART goals. In order to manage stress, it's important to be specific when identifying the stressors, that you can make a plan and then you can take course of action. So the next step is, again, I'm big on this, is identifying what you can and cannot control or change. And so again, our brain, for some reason, goes to the things that are uncertain or that we cannot control. And so initially you want to try to like counter back and forth, trying to figure out, okay, what can I control? What can I change? And help your brain focus on the things that you can control, making a plan around what you want to change, and then going forward. So focusing your attention and energy on the areas that in your life that you can change and control it is key. So then 5, how do we actually do this? Okay, so taking action. So you want to set those realistic goals. You want to set SMART goals. Making a plan is key. So let's say, for example, one of the things that you can control is in the morning before you need to embark on caregiving, you could wake up 10 minutes earlier, and you could get in a nice cup of coffee. So setting realistic goals. If you're not doing that at all right now, then maybe the goal is one time over the next month, I'm going to get up 10 minutes earlier and I'm going to have that cup of coffee uninterrupted. So then you make the plan, right? So it's going to be Tuesday, July 2nd. That's within the month, and I'm going to do it on July 2nd. No matter what's going on, I'm going to get up 10 minutes early and I'm going to have that cup of coffee, or I'm going to go for that walk, or I'm going to make sure that in the next month I call a friend and have a lunch date. Write down the plan. It's interesting, like, you know, when you have things floating around in your brain, sometimes it's hard to organize them. So if you write down the plan, there's 2 things. 1, you can organize your thoughts, but 2, it's almost like this accountability piece. Put it someplace that you can see it, so you're constantly reminded that that is the goal, and that essentially you're putting the mask over your face and ensuring that you're well, so that you can be the best caregiver for the person that you love. Another thing you can do is share the plan with a close friend or a relative that can hold you accountable and make sure that you are caring for yourself. So just a quick word on the emotional side of caregiving. So there's a lot of emotions that come along with caregiving. These are some of the big ones that I usually tend to see in my office and during our groups. And so I just wanted to take a moment to explain some of them, and then also give you some alternatives to how you might cope with that particular emotion. So ambivalence, this is a feeling of both wanting to be doing what you're doing and the feeling of not wanting to be doing it. So this is usually pretty normative when in a caregiver role. So wanting to be the caregiver while also wanting to be doing other things or not caregiving. With let's say a husband and wife that are in their 70s and one's caregiving, oftentimes they say, well, I thought we were going to be traveling during this time of our life. Of course, I want to take care of my husband or my wife, but I wish that we were traveling. So this is some ambivalent kind of feelings. So on bad days, one often has a feeling of wishing that you didn't have to be there, that this ordeal would be over soon. On good days, caring for someone can be a gift to both you and the care receiver. So it can also depend on the day. So a way to cope with this is to be less judgmental of some of the thoughts that go through your head. So allow yourself to feel both sets of feelings. Coming to a more balanced conclusion, while you may not want to be there in this moment, it is a deeply rewarding experience. And it's important to know that everyone has these feelings sometimes, and neither the bad feelings or the good ones will not last forever. So anger, how often have you lost it while providing care? Or you felt like you were on your last nerve? Anger and frustration are a normal part of being around someone who needs help on an ongoing basis and who might not be accepting of the help. So caring for someone is challenging at times. It's not always possible to be perfect controlling your emotions. I want to reiterate that. It is not possible to be perfect in controlling your emotions. And I don't think it's fair to expect this of yourself either. So having the expectation that every once in a while it is going to be too much, and you may have a flood of emotions. So by engaging in some of the strategies that we talked about previously, you can lessen the intensity and frequency of anger. So by engaging in taking care of yourself, taking breaks, setting realistic goals, that can actually be preventative and help you lessen the intensity and frequency of anger. So coping for anger, try to forgive yourself. If you need help forgiving yourself, that's a good reason to go to a support group. That's a great reason to go see a therapist or a social worker that can help teach you ways to forgive yourself. And then find constructive ways to express yourself. So perhaps by using the planned discussion time that we talked about, or giving yourself a break, identify ways that you can gain support and talk about your experience. And then on to anxiety. So feeling like things are out of your control, not knowing how to bring them back into control often produces feelings of anxiousness. And so anxiety can emerge as a short fuse, the impulse to kind of run away from the situation. It can impact your sleeping. Oftentimes people who have anxiety will say that they have heart palpitations, or their palms are sweaty, racing thoughts, or having the urge to cry. So it's important to pay attention to anxiety because it's our body's early warning system that something isn't right. And so when you feel anxious, or you start to feel anxious, stop what you're doing, breathe, keep breathing, anything that will give you a break from what's happening in the moment. There are a ton of apps out there right now that you can get on your phone to help you learn relaxation, guided imagery, breathing exercises. You can do it from the comfort of your own home. This is just another plug as well. If anxiety is a big concern in your life, going to see somebody that can help you manage the anxiety so that you can be a better caregiver. And the last one that I'll discuss is boredom. So I think it's easy to become bored, especially if it's a more sedentary caregiving experience. And so when you're at home taking care of someone and not doing things that maybe fulfill your own wants and needs, and by the end of the day, you're often too tired to pursue something that's of interest to you. So this is where scheduling, taking a break, is going to be key to make sure that you're still pursuing things that are of interest to you. So in closing, some of the key takeaways, as much as you can, try to engage in preventative measures prior to getting burned out. Again, if you're exhausted, overwhelmed, you can engage in these things, but it's always better to do it from a preventative standpoint so you don't get to the point where you may have an outburst and feel guilty. Try to recognize the burnout symptoms as they start. And taking care of yourself is not a luxury. It's an absolute necessity. Again, you can't take care of somebody if you're not well yourself. So again, it's not a luxury, it's a necessity. And the last piece is only when we first help ourselves can we effectively help others. So this is a really good resource, the Family Caregiver Alliance. They have some really great resources out there to help individuals that need support around caregiving. They have a lot of tutorials on different things that you can do to help navigate the caregiving experience. And also, I would plug that if you can get into a caregiver support group, they can be wildly helpful. I understand that most people don't like group therapy or are a little bit scared of it, but there's ways that group therapy can be growthful and really helpful. And so feel free to use that resource as you might like. And that's it for the presentation.